Hi, good afternoon, everybody. I'm Catherine Perry. Thanks for joining me for this session. I'm going to be presenting on promoting health in the early years settings. How can we make it better? I'll be outlining a scheme called the Healthy and Sustainable Preschool Scheme, which has been running across Wales for about 10 years, and explaining how I use this scheme to improve the health of preschool-age children, their parents and their carers. And I'd be really pleased and delighted to hear about any similar work that you're doing in your area. That would be great. So first of all, just to explain the setup of the NHS in Wales, because perhaps you're not living and working in Wales, there are 8 health board areas across Wales, and I'm part of one of those health board areas, Cardiff and Vale University Health Board. In terms of local authorities, there are 22 local authorities across Wales, and the Vale of Glamorgan is one of them, and that's the area in which I work. So I'm just hoping that this screen, there we go. So first of all, a bit of a think about what exactly is the Healthy and Sustainable Preschool Scheme. Well, it's a scheme that aims to improve the health of preschool-age children by working through the childcare settings they attend. So by that, I'm talking about nurseries, playgroups, and childminders. And the scheme is funded by the Welsh Government and coordinated by Public Health Wales across all of the 22 local authorities in Wales, and I coordinate the scheme in one of those areas, the Vale of Glamorgan. So the scheme has been running since about 2011, and although I coordinate it, it's delivered through the efforts of lots of different partners. So we have a multi-agency steering group for the scheme, which is chaired by a colleague from the early years team at the local council. We also have on that group a dietitian, someone from the oral health promotion programme in Wales, which is called Design to Smile, some other colleagues from the council, so for example from the Healthy Living team and the Family Information Service, as well as some people working in early years settings themselves, and also somebody from Flying Start, which is the Welsh Government funded programme to support families with children under 5 in areas of deprivation. We also try to have involvement and representation from some of the excellent umbrella groups that we have in Wales to support childcare settings. So, for example, Early Years Wales, a membership organisation providing support to the early years sector in Wales, Mudiad Maithrin, which is a support group for Welsh medium childcare settings, PACey, the Professional Association from Childcare in Early Years, etc., the National Day Nurseries Association. We try and link with all these groups as well. Some of you may be familiar with the idea of a healthy school scheme. We also have such a scheme running in Wales, and the Healthy and Sustainable Preschool Scheme is similar to it. The idea of promoting the health of children and young people by working through the childcare settings or the schools that they attend. It's a similar concept. So the scheme covers the following areas with a set of indicators that childcare settings have to meet in each one. So I won't read through that list, but you can see there's no particular surprises there. Those are the main kind of health topic areas that we might be thinking about when we're trying to promote the health of children under 5 and their families and carers as well. So within each of those 7 topic areas, there are 4 cross-cutting themes that we try to work towards to ensure that we have this idea of a whole setting approach to the work that we're doing, so that we're not just focusing on a one-off event, but we're really trying to get sustainable change into those settings. So the 4 cross-cutting themes are leadership and communication, so making sure the most senior person in that childcare setting is right behind us and is communicating that to the rest of the team. Planning and delivery, so that's thinking about what, we don't usually use the word lessons when working with childcare, but what activities and sessions are they going to deliver with the children which have the aim of improving health. Ethos and environment, So are the staff also on board with the kind of things that we're asking the children to do? Are staff modelling good practice with healthy eating, with being kind, all that sort of thing? And finally, communities and families. That's the fourth cross-cutting theme. So we know that childcare settings are very important, but actually children spend more of their time in their home environment, and that will have a greater influence on their health, a much greater influence on their health long term. So a health promoting setting needs to be communicating well with families and making the most of what's around them in the community to bring into the setting to promote the health of the children. So this idea of a whole setting approach really is quite crucial, making sure health is high profile in all aspects of the setting's life. So, it's infiltrating every aspect of the child's experience of that childcare setting. So are they warmly welcomed in the morning with somebody with a smile on their face who's pleased to see them? Is there a place for the child to put their bag or their coat? Do they feel a sense of belonging? Is there a predictable routine? Is healthy food and drink provided? Are there, challenging physical activity opportunities throughout the day? Are there policies that promote staff well-being, for example? Because obviously, if you work in childcare, it's a job that requires you to be bright and optimistic and energetic pretty much all of the time. So we need to look after staff as well. So anyway, those 7 topic areas outline the structure of the scheme, which is used right across the whole of Wales, but adapted to meet local situations. So, for example, in the Vale of Glamorgan, some things that we offer that perhaps other areas don't because they'll be doing other things, but we offer settings, a set of health-related toys and books when they join our scheme. We run regular celebration events where our Director of Public Health presents certificates of achievement to the settings. We create monthly newsletters and undertake as many actual sort of face-to-face visits with settings as we possibly can. So just to briefly take one of those 7 areas, for example, if I take mental and emotional health and well-being, the kind of things that we're asking settings to do is have a policy to promote the health of staff. Are they looking at things like supporting staff with flexible working, returning to work after sickness, those kind of things? Are they in place to support staff? Are things like circle time being used to really explore values in a very age-appropriate way, but kindness, trust, those sorts of things, all the way through to perhaps making information available to parents about what services might be available in the community to support them with their mental health. So it's really taking quite a wide view. This is the logo we have for the scheme, which is quite eye-catching and colourful. As you see, we use Welsh as well to profile our scheme, which is really important. And just moving on to think about why the early years, why am I here today trying to encourage the idea of promoting health with the children under 5. And in essence, it's because by investing in the start of life, we can have a far greater impact on a child's future outcomes than by trying to address issues further down the line. So it makes sense from a whole range of different angles, from a financial angle, from a well-being angle. There's overwhelming evidence to suggest that what happens in a child's earliest years will have an effect on them for the rest of their life. And there's a lot of evidence supporting the case for the provision of universal and high-quality early childhood education and care, because children's brains are so malleable at this age, and the experiences that they have will form part of who they are going to be in their future. And research has shown that actually a positive preschool childhood experience has an even greater benefit for children from disadvantaged backgrounds, which of course is crucially important as well in public health. So it's really that kind of, sort of nugget of we can get more bang for our buck by investing in the early years. So that's kind of one of the main reasons why I'm here talking to you about that setting particularly today. So we've established an outline of the project I'm describing and had a brief look at why the early years is an important setting for health. For those perhaps not familiar with Wales, here's a map of Wales. So you can see the local authority areas. I mentioned the 22 local authority areas bordered there. And the area in which I work is the Vale of Glamorgan, so it's right at the bottom in the red circle. So just to orientate you a little bit, the capital city, Cardiff, is just to the right of the red circle there. So the population of the Vale of Glamorgan, the area that I work in, is about 138,000. And for all of us, no doubt, in the areas we work, there are some advantages and some disadvantages. One of the advantages, I think, of working in Wales is that it's a relatively small place. So, I can relatively easily communicate with the coordinators of the Healthy and Sustainable Preschool Scheme in the other local authority areas of Wales, because there's only 22 of them. So forming relationships and finding out who's particularly skilled at this or that and who will be able to give you an answer on that particular question is quite easy to do. And there is an awful lot of excellent good practice sharing and that kind of thing across Wales. So in the Vale of Glamorgan, the largest town is Barry, and if any of you are fans of the Gavin and Stacey TV show, you'll be familiar with Barry. Other large towns in the area are Penarth, Lantwick Major and Cowbridge, and it's a very varied area in terms of deprivation. Some very deprived areas, some much less so. So thinking about free school meal rates as an indicator, the average rate of free school meals across Wales is around 20%. In the Vale of Glamorgan, one of our schools has a rate of 64%. Other schools have less than 1%. So it is a very varied area. It's also very varied in terms of having some urban areas and some rural areas, so that presents all sorts of challenges and just different issues to consider when we're promoting health. But this is a big problem in Wales. Poverty is a big problem, and 45% of Welsh households never have enough money for anything other than the basics. So when delivering the Healthy and Sustainable Preschool Scheme, we try to deliver our work in a way that reduces inequalities in health as much as possible. So when we first began the scheme about 10 years ago, we had to decide how to prioritise which childcare settings out of the 200 or so that we have in the area to join the scheme. So we looked at deprivation data and invited settings in the most deprived areas of our area to join the scheme first. So I mentioned at the beginning that we have a programme called Flying Start, a Welsh Government-funded programme which aims to make a difference to the life chances of children by mitigating the impact of poverty, which is linked to poor life outcomes in early childhood, including health outcomes, as I mentioned before. So childcare settings that fall into the geographically defined Flying Start areas were obvious choices for us to begin with. So they were some of the first settings that joined the scheme. And we've gradually added settings and now have around 40 that participate. So we try to prioritise promoting initiatives that will help families maximise their income. So you can see here some of those programmes that we particularly encourage settings to profile and promote to the families that use them. So you've got some logos here, I'm sure you can see. So the Healthy Start scheme, if you're familiar with that NHS scheme. So if you're more than 10 weeks pregnant or have a child under 4, you may be entitled to get help to buy healthy food and milk. If you're eligible, you'll be sent a Healthy Start card with money on it that you can use in participating shops and benefit. The money is added to the card every 4 weeks. Other programs there that you can see, the Nutrition Skills for Life program, which is a training program delivered across Wales to skill up childcare workers, teachers, community leaders, anybody really, on how to promote healthy living and healthy eating. We've got the Circular Dragon logo there is a program called Design to Smile, which is an oral health education program running in Wales. And that is offered on a targeted basis to more deprived settings. So again, we're trying to promote the Design to Smile program, which encourages things like toothbrushing actually in the setting, to try with the aim of obviously trying to decrease tooth decay. The red logo, it's quite a detailed one, but that's promoting a program called Busy Feet, which is a physical activity program that can be done indoors or outdoors. That's something that's gone down particularly well with our settings. And then the food and nutrition logo down at the bottom right there, that's the Welsh Government guidance on food and nutrition in childcare settings, which came out a few years ago, which is a bit of a Bible for all our childcare settings to use for any food and nutrition related question that they might have. So we make sure that they are all as clued up as possible by using those guidelines. So that's just some of the things that we try and promote. So just getting down specifically to a specific project that I've worked on with my settings. As this kind of initial panic of the pandemic began to subside a little, we had to think as a national healthy and sustainable preschool scheme network about how we could best promote the health and support our settings at this really difficult time. So you may remember that when many other organisations and schools were closed due to the pandemic and the lockdown, many childcare settings remained open for the children of key workers. So I think, working with childcare settings, my impression was that for some childcare workers, that was a good thing. It gave them a purpose, it gave them a sense of normality to get up in the morning and go to work as usual. But for others, it became a challenge. I think probably for all of us, many of us, our home and our work lives became very much more blurred during the pandemic. And I think for many childcare workers, if they had vulnerable family members or elderly family members at home, going out to work in a childcare setting was quite a daunting prospect. So we needed to be very mindful of that and try and be as supportive as possible. So it was decided nationally that we would focus our work on supporting childcare settings around these three priority areas: mental and emotional health and well-being, infection prevention and control, and physical activity. I think probably, quite obvious priorities really coming out of the pandemic. And we were thinking about how could we galvanise action in childcare settings around these priorities at a very challenging time. So before I start talking about this particular slide, just to fill you in on a piece of work that I did. So I was trying to support and encourage the childcare settings to develop their work around those three previous priority areas that I outlined. And essentially, we said to them, we're going to give you a grant, we're going to offer you a grant for you to use as best you think fit to support the health of either the children or the staff or both around 1, 2 or 3 of those topic areas, and we will give you some funding up to £200 to be able to put something in place. So I'm going to speak to you now a little bit about one of those childcare settings, a playgroup called West End Playgroup in Barry, and how they used the funding that we gave them. So they used it to focus on the physical activity and mental and emotional health and well-being aspects. And essentially they developed their outdoor area into a much more inviting and usable and health promoting space. And just to jump ahead a bit, a few months later, they used the work that they had done as a submission for an award from Early Years Wales, which is one of the umbrella organisations we have in Wales. I mentioned it earlier. And they were successful in winning the award for the outdoor space, small but mighty. So that slide there, I know it's a bit small, but hopefully you can see a little bit. The top right is a picture of how it was before. So it was just a pretty kind of scrubby strip of grass, basically running alongside the church hall in which the playgroup ran. And I'm going to show you some more photos in a minute of what the setting did to develop the area further. So if I just move to the next. So they developed various areas of their strip of land that they had using the grant I'd given them, but also other grants from other places. So one of the things that they did was develop a growing area. So you can see here some of the children nurturing and looking after some of the things that they were growing. They had some planters and the wooden border you can see there donated by a local garden centre. One of the other projects that we run is a potato growing project where we give all our settings a potato growing kit which contains everything except the compost that they need to grow potatoes. So I'm not sure if we can see any potatoes there, maybe in the top leftish. But again, you know, it's making it as easy and safe as possible. We know that when children are outside, they move more than when they're inside, even if there's no organised activity for them to do. So another kind of purpose with this work was getting children outside as much as possible because they move more, they're going to be more active. And if they can learn more about food and how it's grown and, you know, where it comes from, so much the better. So that's another angle. So the grassy bit that you just saw is kind of in front of that tunnel with the green face. So there you can see some of the other uses that the land was put to by purchasing some of this equipment. The red canopy area is used in a multitude of ways. So it can be used as like a quiet area for storytelling. They can bring art and craft and painting and all sorts of fairly messy activities outside, and it's easier to not have to worry so much about the clearing up. And so they do use that covered area for kind of circle time activities, to think about emotional health and well-being, to have a quiet area, and just to not to go into great detail, but you know, many childcare workers tell me that some children who have quite challenging behaviour inside, their behaviour is often much more positive outside. So there are lots of benefits for some children about literally just being outside. And there's just another view there of some of the activities and some of the equipment that the setting was able to purchase. The strip of grass on which all this is happening, it borders the church hall one side, as you can see there, and on the other side there's a fence and it borders the road and pavement. It's in a residential area. So it's very visible to the community, to the neighbours, and the playgroup found that by improving their outdoor area, it had lots of benefits. One of the benefits was the children were keener and the staff were keener to get outside and make use of the area, but also the local residents, as they passed by, they would see them, they would talk, they would interact with the children. And for some, that was, you know, from a sort of intergenerational communication point of view, there were lots of benefits to be had by all. So that was another unintended positive that came out of this piece of work as well. And the setting itself have since decided that they're going to develop it even further by developing a sensory area and I think a musical area and some different areas as well. This picture, if you can see, I just put it in because this was the setting's plan of how they were going to develop the area before they even started. And the reason I've included it is because I wanted to mention that many childcare settings are quite low tech, and I don't mean that in any critical way at all, but just that they don't have, a lot of them don't have somebody who's sitting in front of a computer all day to fill in applications or draw up fancy planning documents. They literally, like this slide shows, draw up plans on back of envelopes because there's nobody spare in the setting, there's nobody additional, there's nobody extra to do anything more than that. And this was the plan that West End Playgroup had for their outdoor area. and it did the job, and it worked perfectly. And I think, again, one of the wonderful things about people who work in childcare I have found is that they are very practical, and they'll find a way around it, and they just get on with things. So that's why I included that slide, because I just wanted to sort of say, where there's a will and there's a way, somebody will get the job done. So just to sort of think about some of the key messages that, as I reflect on this project and my work with childcare settings in general, childhood experiences have a lifelong impact. I think often we think of the early years phase as a kind of waiting room for school, and that the real learning happens in school. But really, I think childcare and early years settings are crucially important in their own right, because if we get things right in those early years, everything else following on from there will flow much more easily for that child, and their outcomes in life are likely to be more positive. Children often attend childcare for a short time, so every moment counts. So the Flying Start programme we have here in Wales, most children attend that for just a year, maybe 4 terms for some children, but it's not much. So we really need to capitalise on every opportunity that we have with childcare settings. I've spoken about childcare workers a lot. They're often undervalued but have a huge role and responsibility. So we have around 23,000 childcare workers in Wales. And we through the Healthy and Sustainable Preschool Scheme, we try and be as supportive and acknowledging of their work as we possibly can. And just a key message, the fourth one there, is just that we need to deliver now. I think the cost of living crisis is happening right now. People need help right now. So I know in public health we need to be thinking about sustainability and a long-term improvement. But at the same time, I really do think we need to be thinking about what sort of things we can do right now to help families, because now is when they really need it. So just really to finish off, a few thoughts from me, just really, thinking about the difference between an adult and a preschool child. As adults, our ability to manage our emotions, to concentrate, to handle pressure, to form relationships, to believe in ourselves and to trust other people, etc. All those things are informed by our earliest experiences. And those earliest experiences will then impact on our life satisfaction and our outcomes, including our socioeconomic status, our physical and mental health, and then how we parent the next generation. So this is because our brain is at its most receptive and adaptable when we are young. And although we continue to adapt and evolve throughout our lives, as we all know, it requires more effort as we age. So that's some of the reasons why I really do think it's so important that we focus on the early years as much as we can, and really capitalise on some of the benefits of doing so. And so pretty much that's the end of my presentation. So thank you for listening. All visitors to the Vale of Glamorgan are very welcome. Do get in touch. And I'd love to hear any examples of your own good practice happening in early years settings, because the more we can share this information, the better, I think. So thank you very much for listening. If I can find my way to the chat, I'll see if there's any comments in there. The Scottish Borders Health Improvement Team works closely with early years centres across the region. It's interesting to see the similarities in Wales. That's great. Thank you for that. Oh, engaging dads. Okay, my colleagues here have started on a program called DadPad, which is a iPad-based app for dads to find information about parenting and how to engage with their children a bit better. So there's a bit of work that we've got going on locally around there. And our Flying Start settings have a group that they call Men Behaving Dadly, which they, through which they support fathers with information about children and health and raising a child and supporting them generally. So there are a few things going on around the involvement of dads, and I think it's a really important area for doing more on in the future as well. Oh, somebody else has Dad Pad. That's great. That's good to hear. Thank you. So thank you very much for attending, and enjoy the rest of the conference.